right, Mayor Pete Buttigieg is unveiling his health care plan this morning. Joining us now with the details is national political reporter for NBC News, Josh Lederman. Josh, what do you got?
So, Mika, what Pete Buttigieg is proposing for his health care plan is a midway point between the status quo, Obamacare, and full-on government-run health care. And he thinks that a big part of this is about trying to remind voters that this is not just a three-way contest of ideas between Bernie Sanders and Elizabeth Warren and Joe Biden, that he has some ideas too. His theory is that by introducing a Medicare public option for folks, but without imposing it across the board, that it will eventually, over time, become so popular that through natural competition, it will drive some of these insurance companies out of business. And when I spoke to Pete Buttigieg about his plan last night, he was pretty critical of some of those frontrunners, particularly Elizabeth Warren.
In what way?
Well, he suggested that their plan to basically get rid of the private insurance and put everyone on Medicare was commanding Americans to abandon the coverage they had. And he actually told us that he thinks that's inconsistent with America's commitment to freedom. So you really see him trying to sharpen the knives a little bit as he tries to break into that top tier.
Corinne, what do you think?
Well, my question to Josh is, what's the difference here? I was just reading a little bit about it. What's the difference between his plan and Senator Harris's plan? It seems very similar. So what makes this plan stand out?
Yeah, a lot of the candidates here are really grasping for ways to distinguish their plans that essentially, look, all of the Democrats are saying we need to make our healthcare system more progressive. We need to have a government option. So there are some fine details that differentiate his plan from Kamala Harris's as far as how subsidies are provided, how people are enrolled, whether it's automatic enrollment into this new plan or something that you have to opt into. But I think what you're getting at accurately is that on the surface of this, a lot of these plans are more alike than they are dissimilar.
Look, I think what the key point here is that you're seeing an increasing number of the candidates in this race pushing back on the idea of Medicare for all. And if you watch the last debate, it was happening there, and it's happening again with Buttigieg coming out. And they are essentially very similar, but what they're trying to do is maintain private insurance. There are 160 million Americans who get their insurance from their employer, and contrary to what Elizabeth Warren said at the last debate, most of them are actually quite happy with it. And so this is, again, just another variation. But the good news for the Democrats is you now have an increasing number of Democratic presidential candidates who are signing up for Medicare if you want it.
And in fact, Mayor Pete was critical of Senator Warren and Sanders on the stage at the debate the other night. So, Josh, let me ask you then, seems to be the million-dollar question, and some people think could be a lethal one for Elizabeth Warren if she becomes the nominee, and that is the idea of taking away private insurance. As I read through Mayor Pete's plan, it says it will move millions of Americans into government-run health care without imposing it on Americans all at once. Does that mean eventually all Americans will be moved off private insurance into the government program?
That's his theory of the case. And I asked him, look, if you're sitting in the C-suite of Cigna or Blue Cross Blue Shield or one of these big insurance companies reading this plan, are you basically reading a death plan for your industry? And he says, well, no, you look at other countries where private insurance augments the coverage that you get through your main insurance. And frankly, he says that if those insurance companies just compete well enough with this public plan, then there won't be any need for them to go out of business. But certainly, if you follow the trajectory of what he's predicting, it does basically move most, if not all, Americans into some type of government-run insurance.
But it doesn't force them off. Is that the distinction he's making?
That's right. And that's what makes this fundamentally more moderate than some of the more liberal candidates, is he's trying to focus on choice, not infringing on people's freedom to make that decision voluntarily.
All right, NBC's Josh Lederman, thank you. Karine Jean-Pierre, thank you as well. And coming up, after stepping down as defense secretary, James Mattis said he owed the Trump administration a duty of silence.
John Bolton? Not so much.
No, just a little bit different, actually. We're going to get David Ignatius's take on those new comments that he made yesterday about the president. Plus, in just a few hours, the House Intelligence Committee will meet with a key figure in the battle over that whistleblower complaint that the Trump administration is fighting to keep under wraps. We'll talk to a member of that committee, Democrat Jim Himes. And the AP's Jonathan Lemire joins us with his new report reporting that posted overnight on Trump's hesitation to engage in foreign conflict despite all the bluster.
Also, thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.